Hello and welcome back to the video series dedicated to the high-level overview of the construction safety and health textbook. So today we are going to cover part 3, and that is application on the job. And the chapters that are covered in this part 3 are 12 through 16. So let's start with chapter 12, and that is about construction safety and health program and policies. So what is important to know here in chapter 12 is actually there is a disagreement among construction professionals concerning the need for safety and health plans and programs. However, the evidence shows that well-written safety and health plans can prevent accidents, illnesses, injuries, and the expenses associated with them. Unfortunately, behind every silly rule and regulation, there is an accident or death. And that is why that rule is in place now. So there are ethical, regulatory, economic, and practical reasons for having comprehensive written safety and health plans. Such a plan should have at least the following components. Safety, the first one is safety and health policy. The second one is safety and health goals. The third one, roles and responsibilities. Then number 4, discipline, policy, and procedures. Number 5, job site inspections. Number 6, accident investigations. Number 7, record keeping. Number 8, training. Number 9, medical response and first aid. And then number 10 is emergency response. Communicating the safety and health plan to all employees is important and should include a variety of strategies. Effective strategies include the following. 1, face-to-face meetings. 2, bulletin board notices. 3, chalk talks by supervisors. 4, new employee orientations. 5, audio tapes. 6, videotapes. 7, newsletters, memoranda, and bulletins. 8, signs and posters. And 9, setting a positive example on site. It is important to evaluate in the safety and health plan for content and processes. Checklists that follow the pattern of the plan can be developed to help simplify the evaluation process. And that concludes chapter 12. We're moving to the chapter 13, and that covers hazard analysis and construction equipment safety. And what is important here in the chapter 13? Let's take a look. So chapter 13 says that a hazard is a condition or combination of conditions that, if left uncorrected, may lead to an accident, illness, or property damage. Hazards can be ranked as a potentially catastrophic, critical, marginal, or nuisance ones. Hazard analysis is a systematic process for identifying hazards and recommending corrective action. There are two approaches to a hazard analysis: preliminary and detailed. A preliminary hazard analysis, or PHA, involves forming an ad hoc team of experienced personnel who are familiar with the equipment, material substance, and process being analyzed. Experience and related expertise are critical in conducting a PHA. Failure mode and effects analysis, FMEA, is a detailed hazard analysis, DHA, method that involves dividing a system into its various components, examining each component to determine how it may fail, rating the probability of failure, and deciding what effect these failures would have. Hazard and operability review, HAZOP, is a DHA method that was developed for use in the chemical industry. It involves forming a team of experts and brainstorming. Human error analysis, or HEA, is used to predict human error and its potential effects. It can be used in conjunction with FMEA and HAZOP to straighten those approaches. Technique of Operation Review, or TOR, is a hazard analysis method that allows workers and supervisors to conduct the analysis. It uses a simple worksheet that allows team members to respond to a sequence of yes or no options. Fault tree analysis, or FTA, is a hazard analysis method that uses a graphic model to display the analytical process visually. The model resembles a logic diagram. Risk analysis, although more commonly associated with the insurance industry, can be used for hazard or safety analysis. The process revolves around answering two questions. How frequently does a given event occur? And how severe are the consequences of a given event? The fundamental rule of thumb of risk analysis is that risk is lessened by decreasing the frequency and severity of hazard-related events. The fundamentals of hazard prevention and deterrence include the following strategies: eliminate the source of the hazard, substitute a less hazardous substance, reduce the hazard at the source, remove the employee from the hazard, isolate the hazard, dilute the hazard, apply appropriate management strategies, use personal protective equipment or PPE, provide employee training, and practice good housekeeping. Risk assessment should answer 4 questions. 1. How severe are potential injuries? 2. How frequently are employees exposed to potential hazards? 3. What is the possibility of avoiding the hazard if it does occur? 4. What is the likelihood of an injury if a safety control system fails? The 4 categories of methods for reducing the hazards associated with heavy equipment operations are site planning, signals, training, and warning devices. And this concludes chapter 13. We're moving to chapter 14. That is all about accident investigation, reporting, and record keeping. So what is important to know in chapter 14 is that the accidents are investigated for the purpose of identifying causal factors that could lead to other accidents if not corrected. The purpose is not to assign blame. It is important to begin an accident investigation as soon as possible after an accident occurs, so that evidence and the memories of witnesses are still fresh. Facts to be uncovered in an accident investigation can be summarized as who, what, when, where, why, and how. So answering those questions will help the investigators. Who conducts the accident investigation can vary according to circumstances. However, regardless of how it is done, a safety and health professional should play an active role in the process. Steps for conducting an accident investigation are as follows. A. Isolate the accident scene. B. Record all evidence. C. Photograph or videotape the accident scene. D. Identify witnesses. And E. Interview witnesses. Witnesses to accidents fall into one of 3 categories: primary, or eyewitnesses; secondary, were present at the scene but did not see the accident; and tertiary were not present but have information that may be relevant. Interviews should take place at the accident site whenever possible. When this is not practical, interviews should take place at a neutral location that is private and where the witness is comfortable. The keys to getting at the facts in an interview are as follows. Put the witness at ease, ask open-ended questions, and listen. Interrupt only if absolutely necessary. When possible, let eyewitnesses reenact the accident through simulation at the job site. Do not let them actually perform the tasks that led up to the accident. The purpose of an accident report is to record the findings of the accident investigation, the cause or causes of the accident, and recommendations for corrective action. Report forms should meet the record-keeping specifications of Osha. And this concludes our chapter 14. We are moving to chapter 15, and that is all about emergency response plan. So what is important to know about the emergency response plan is that an emergency is a potentially life-threatening situation, usually occurring suddenly and unexpectedly. Emergencies may be the result of natural or human causes. Preparing for emergencies involves planning, practicing, evaluating, and adjusting. An immediate response is critical in emergencies. The Emergency Planning and Community Right to Know Act has the following four main components: emergency planning, emergency notification, information requirements, and chemical release reporting. For proper coordination of the internal emergency response, there must be one person in charge and everyone involved must know who that person is. Because there is no way to predict when first aid might be needed, part of preparing for emergencies should be preparing employees to administer first aid. In certain cases, OSHA requires that companies have at least one employee on site who has been trained in first aid. In addition to providing first aid training, well-stocked first aid kits must be readily available. Personal protective devices and post-emergency telephone numbers must be available, and all employees must be kept informed. A company's Emergency Action Plan, or EAP, should be a collection of small plans for each anticipated emergency. These plans should have the following components: procedures, coordination, assignments and responsibilities, accident prevention strategies, and schedules. The EAPs should be customized so that they are location-specific by including a map, an organizational chart or org chart, local coordination information, and local training schedules. An emergency response team, ERT, is a special team to handle general and localized emergencies, to facilitate evacuation and shutdown, to protect and salvage company property, and to work with civil authorities. An emergency response network is a network of emergency response teams that covers a designated geographical area. Trauma is a psychological stress, which typically results from exposure to a disaster or emergency that is so shocking that it impairs a person's sense of security, reality, or well-being. Trauma, left untreated, can manifest itself as PTSD, I'm sorry. This disorder is characterized by intrusive thoughts, flashbacks, paranoia, concentration difficulties, rapid heartbeat, and irritability. And this concludes our Chapter 15, and we're moving to Chapter 16, Total Safety Management. So what is important to know about the total safety management is the total safety management is an approach to safety and health management that gives companies a sustainable competitive advantage in the global marketplace. This is accomplished by involving all employees in establishing, maintaining, and continually improving the work environment so that it's conducive to consistent peak performance. The fundamental elements of TSM are its strategic basis, performance operation, executive commitment, teamwork orientation, employee empowerment and enlistment, scientific decision making, continual improvement, comprehensive and ongoing training, and unity of purpose. The rationale can be found in the connection between job performance and the work environment. To compete in the global marketplace, companies need all employees at uh, uh, performing at peak levels on a consistent basis. A safe and healthy workplace promotes peak performance. The model for implementing total safety management, or TSM, consists of 15 steps arranged in 3 phases. These phases are planning and preparation, identification and assessment, and execution. And this concludes our chapter 16 and our part 3. The next video is going to be about part 4, and that is related to other safety and health issues and practices. Thank you so much for watching. I'll see you in the next video.